Hey, if you are new to Table Talk, welcome. We create content for these talks based on families like you. So if you have a topic you would like for us to discuss, or if you're interested in connecting with a community health worker, please contact us on one of our social media platforms or call or text us at 614-570-3592. Table Talk is held the fourth Thursday of every month. Please be sure to help us spread the word about the C1 Table Talk. So like and share our video, and please tag your family and friends. Today we're going to talk about Black maternal health and birth justice. And I am joined today with Akila Muntakim from Mothering Justice in Detroit, Carol Haynes, Director of Kiddie Academy in Reynoldsburg, and Michelle Miller, Birth Equity Peer Researcher. So I'd like to start with Akila. If you could kindly tell us a little bit about yourself, Mothering Justice, and the Mama's Agenda.
Absolutely. Thank you so much, Christina, for welcoming me here today. I'm really excited to be participating. Again, my name is Akila Montakim. I am the Deputy Director at Mothering Justice. I'm also a mother of four. This is my office manager, Naima. She is sleeping on the job. And I'm also a community advocate of mamas just like myself. Mothering Justice is a nonprofit organization based out of Detroit, Michigan. Our mission is to empower mothers of color, whether they are Black or Indigenous, to influence policy on behalf of themselves and their families. We are an economic justice centered nonprofit organization, and we really want to make sure that mothers' voices are the dominant part of policymaking. We do this through our Mama's Agenda, which focuses on affordable childcare, Black maternal health and reproductive justice, basic needs security, which really centers around, clean air, clean water, housing, health care, and all of the basic needs that we require as human beings to survive, and also pay family leave. We always are working to implement new policies, abolish those that seek to threaten the forward movement of our Mama's Agenda, and amend any existing legislation to uplift newly found needs in our community. So I really love the work that we do at Mothering Justice. It really has made a significant impact on my life, especially within the last year that I've been introduced to the organization prior to becoming a staff person. So thank you again so much for having us.
This is incredible work that you all are doing. So last week was Black Maternal Health Week, and the White House issued its first ever presidential proclamation marking Black maternal health as part of the administration's broader efforts to address racial inequities in pregnancy and childbirth related deaths. And Vice President Kamala Harris said that Black women in our country are facing a maternal health crisis. Akila, what are some of the solutions we should be considering to prevent Black maternal deaths and severe complications? For example, would the expansion of Medicaid or universal health care help lower or altogether wipe out Black maternal mortality and morbidity?
That's a great question, Christina. And absolutely, the expansion of Medicaid would be a huge help in reducing the statistics that Black, Indigenous, and mamas of color face when they're starting a family. The Affordable Care Act has really reduced maternal morbidity and mortality. A study that was done between 2006 and 2016 showed that the Care Act really had a huge impact on lowering those statistics. Also, we are doing work to help bring more Black birth workers into the medical space, to make them more available, to help them be acknowledged, and really to give them access to the training that is required for them to be the powerful advocates that we know that they are to women in our community and families, because they don't just support the mom, they do support the whole family. So yeah, those are the things that I believe would make a huge difference in helping to save Black mamas and their babies.
I'd like to shift for a moment and talk about preparing to start a family. So, what are the things that Black, Indigenous, and people of color should prep for when starting their family?
Well, I'm also a certified lactation specialist. I said in the beginning, I wear a whole lot of hats, and that's one of them. And one of the things that I tell all of my clients is to really take advantage of the education and the resources that are available, whether it's Google or, setting up time with a doula or a midwife or a lactation specialist. If you're even just thinking about starting a family, you don't even have to be pregnant yet. I really do think that introducing this type of information about childbirth, pregnancy, and that postpartum period is important for our young people as well, so that they know what to expect. It was really nice that my children got to participate in my home birth last year. So the oldest is 10 and he knows a whole lot now about how that process works. But I think it does make a difference when you have the education that you need to be able to feel empowered and to feel safe in your care. So definitely make sure that you document everything, develop a birth plan. Again, you do not have to be pregnant to do any of these things. It's just like when we were all, young and we were like, I want to get married and this is the ring that I want. This is my collage of wedding dresses that I'm going to pick from. It's really the same because having a family and having children is a huge responsibility, and there's so much that goes into it. And I definitely don't like when I have to talk to moms where they're sweating in the hospital bed trying to figure out how to feed the baby. So I always encourage families to book those prenatal sessions. You don't have to be pregnant to have a midwife. You can develop that relationship prior to getting pregnant because midwives do regular gynecological care as well. So get as much education as you can in advance.
So the next question I have for you is it important that if you are Black, Indigenous, or a person of color, that your provider comes from the same background as you? So if I'm a Black um, pregnant person, is it important that I have a Black provider or well? Is that a must? Or just love to hear what your thoughts are around that.
It's not necessarily a must. I think that it is a need, right? And so a lot of times it's also a want. I know that I really, this time around when I had our fourth baby, I really wanted to have a Black provider and a Black team of providers because, we have so many cultural differences sometimes, and it makes it a lot easier when you have the support of someone who looks like you, who has a similar background. I'm also Muslim, so sometimes you might not be able to get a Black Muslim provider, but you can get a person of color who is also Muslim who can understand your need to cover and things like that. I do think that having Black birth workers be present in the space and be accessible is very important. But I also think that, you have to consider all of the things that make a difference for you and your care. So it's really an individual decision. But for me personally, it was very important to have at least a handful of Black folks on my team. So that way I felt like the things that I would face as a Black woman in entering into the medical space were heard and acknowledged.
Thank you. And I'd like to talk a little bit about diversity. Is diversity on your birthing team the key?
Yes, because like I said, we're all different. And you can be like me, a Black Muslim woman. So you have a couple different things that you need to consider when you're choosing your team that are important. So if you are like me and you are Muslim and covering is important to you, even if you aren't Muslim, but if covering is important to you, you may not want to have a male medical staff person on your team. You may not want them to be in the room when you deliver for reasons that are for you for modesty. And those things are really important that you share with the folks that are supporting you during your birth and even after birth when you're breastfeeding. Because some people, like me, I take the shirt off, move everything out the way. I might have a blanket, I might not, but that's okay for me. But for some, they really do feel that it's important that they have some privacy when it comes to that. So I do virtual lactation sessions, and I always ask my clients in advance, hey, I have 4 kids, 2 of them are boys. They like to burst into the office. I just want to make sure what is it that you're comfortable with so that if I need to go out in the car and do our lactation session to make sure nobody can access me, then I'll do that. So diversity is important, but again, it really depends on that person, the birthing person, and also their families and what those needs are specifically.
So the CDC launched the Hear Her campaign to raise awareness of the warning signs to look out for during and in the year after pregnancy. So, what are some of the health indicators or symptoms expectant parents should look for and contact their doctor or midwife about right away?
That's a great question. I have a support group on Facebook called the Mom Gang, and every single day we see either women who are pregnant or just had a baby asking questions about things that they're concerned about. I also want to start by saying that nothing is a dumb question when it comes to your health and well being and that of your baby. So never hesitate to call your medical provider right away when anything seems out of the ordinary. Your intuition is rarely ever wrong. So if you are not feeling your baby kick as much, if you're feeling more kicks, if you're feeling the baby do hiccups or something is a little off, always pick up the phone and call either the nurse's line, call the emergency room, or walk into labor and delivery to be seen. That's another reason why I always tell folks to, if you can't have a doula, to do that. Doulas are not just for people who are well off. They have sliding scales and different payment arrangements you can make, but have a doula because it is very important to have someone to help you articulate what is going on if maybe a medical professional doesn't quite understand. If you have high blood pressure, it's important for you to make sure that you're aware of those things. I had one mother, my friend Tamika Isaac. She traditionally had, a little bit lower blood pressure, but for her that was normal. So when she saw the elevations, the medical team didn't think anything of it. And, she missed some treatment with that. She also didn't ever get her urine tested throughout her pregnancy. And that's something that, happens all the time when you go, even when you just go to the doctor for a non-pregnancy related appointment. They're like, here's the cup, go use the bathroom and come back and give it to me. But she didn't have that. And unfortunately, she lost her son and almost lost her own life as a result of that lack of care. So if you have any pre-existing medical conditions, please be aware of those things. Blood clotting, heart conditions, so that way your team is informed and so that you know what to look for. And that really goes back to that education piece, because it could really be a matter of life or death for you, but never feel like you're bugging anybody about your care, because those physicians and that medical team essentially work for you, and it's important that your voice is heard in all of your concerns.
Thank you so much. I personally feel like I have learned so much today. So I really appreciate you. And also, I was so glad that you mentioned different types of birth workers and doulas. And just to let our viewers know that if you're interested in working with a doula, you can get a referral from a community health worker. And again, the number for the community health worker is 614-570-3592. And we can connect you with a doula at low cost or no cost. Um, Again, Akila, you've given us so much to think about today. Where can our viewers go to learn more about your work at Mothering Justice? And, I know you're in Detroit. Is there a way that folks can still be involved here from Columbus, Ohio?
Absolutely. Anybody is more than welcome to contact me directly. My email address is Aquila, Aqueela, at motheringjustice.org. You can learn more about Mothering Justice, our leadership development programs, and our upcoming events by visiting our website, which is motheringjustice.org. You can also follow us on social media across all platforms. We are Mothering Justice. You can follow me if you like. I use my real name on all social media as well, so it's easy for people to find me. So feel free to always reach out. We love having folks join our cause, because we don't just work on a local and state level here in Michigan. We really do have some national initiatives, especially when it comes to affordable childcare, basic needs, Black maternal health and reproductive justice, and paid leave. That affects all of us no matter what state we're in. So always feel open and welcome to contact any member of our staff to talk about and share your story, because that's really what influences our work, is the voices of the mamas in our community.
Thank you so much, Akila. And that's such a great segue into talking about raising up the voices and sharing our stories. So now we have Carol and Michelet. I understand that both of you will be hosting listening sessions with pregnant and parenting people. So, Carol, I'll start with you. Can you kindly tell me about the listening session you're planning and why it's important?
Thank you, Christina. Thank you for having me today. Absolutely. Our listening session really is focused on deepening really the conversation just around awareness and letting moms know that they are not out there alone in this. We want to uplift their voice and we really want to show really just what they're experiencing out there in the community. I think one of the things that we also want to make sure that is valued is the fact that these sessions will be an opportunity for families, moms and dads, to come and really discuss what their experience was like, and then really just to show the brilliance of Black mamas and to really understand the phenomenon that's going on in with providers and in our health system as well.
That's wonderful. And when will the listening session be held?
Our listening session will be held May 11th at 7 p.m. at 6411 East Main Street. So at Kiddie Academy of Reynoldsburg, we're planning to hold that session there.
Wonderful. And I'll just share with our viewers, if you're interested and would be available to attend, please reach out to a community health worker and they can get you connected on how to register. We'll also be sharing this information on our social platforms. And again, the number to connect with a community health worker is 614-570-3592. Carol, I wanted to ask you, I know you come from a background of working in early childhood. What prompted you to host these listening sessions? I don't know if you have any personal experiences. I was just curious to learn a little bit more.
Yes, thank you. So I am a nurse and nurse practitioner by training and by background, but my personal experience centers probably about 30 years ago when I had a high-risk pregnancy and I had my daughter. If you fast forward to 19 years ago, she had a high-risk pregnancy when she had my grandson, and so she was actually up in Lucas County. And was on bed rest for a bit of the time. And as we kind of walked through that process with her, once we had her delivery and we were there in the delivery suite, she had an extreme amount of blood loss and worked with the physician there to make them aware of that. I try to kind of hide my emotions a bit, but she always knows when I'm concerned because I have a disposition where I put my hand on my face and kind of cross my arms. But when I heard the term hemobate, I knew that we were in the middle of a crisis. And then very quickly, her heart rate went up, blood pressure dropped, and she was cold and her vision changed as well. And so that trauma that she experienced and even for me, as a healthcare provider, knowing everything that was going on, but really that experience as her mom and being really helpless, feeling helpless at that time to get things turned around, but knowing that we almost lost her. So, she had a second pregnancy. And so for me, seeing that from 30 years ago to just 2 years ago, things had not yet really changed because she originated the pregnancy in New Jersey and moved back to Ohio. There was a miss on the handoff of care. But what happened when she got to the clinic here in Columbus just really sounded an alarm for me. When a physician, a high-risk physician, can say to my daughter, who's highly educated, a master's degree out of Columbia, but still yet on Medicaid, had said, hey, how are you doing? How are you being treated? Because we're finding that Black moms on Medicaid have poor experiences here in the clinic. Based on some of the experiences she had, he moved her out of the clinic. But that should not have to be like the norm for folks to get a basic level of care, here in Ohio. And so we're fighting to make a change. But I really look at him as being kind of her savior, or even her angel, because he was able to really push her through and walk her through the pregnancy in a safe manner. But when she went into labor and she arrived at the hospital, they placed her in a room and no one checked on her. Luckily, I had a friend and a former parent at Kiddie Academy that was able to get me back to talk to the resident because no one had been in to so much as take her vital signs. And so they were laughing and kind of having a good time at the station. I approached the chief resident and I said, can you please go in and check my daughter? She has a history of a postpartum hemorrhage and she's been hemobated. It wasn't until I said that drug that they got up and checked on her. And so she had a baby in less than 30 minutes of walking in the door of the hospital, no IV, no medication, nothing. And so I knew from her history that that could have been a bad situation. But the key there is that no one was willing to listen to her. But she was saying, I need to push. Can someone come in my room? But after calling out 3 times, no one had come. And so that's my personal side of doing that. As well as, we had a parent at Kiddie Academy who had a baby and died during that postpartum period within 24 hours of having her baby. And again, in talking to her family, they told me that they asked for someone to come and check on her. They didn't have any specific concerns. She just kept saying something's wrong. And so we lost her. And so it part of the work that we're doing is just making sure that, we can echo and raise the voice of the moms that we're serving. And so in early childhood, I think that, what better environment to be a part of the solution. We've got a captive audience. Most of the moms that are having difficulty after pregnancies have had a prior birth or a prior pregnancy. And a lot of times you'll find them in early childhood centers and academies. And so that's why Kiddie Academy is doing the work that we're doing. That's why we're proud when the Ohio Department of Health said, hey, we want you to host a listening session. And so that's why we're doing the work.
Thank you for sharing that powerful story and for hosting this listening session. I think this is incredible and what is needed. Michelet, I'd like for you to tell us a little bit about your listening sessions that your team is planning. And, I've never heard the role of peer researcher. If you could tell us a little bit about what that is.
Absolutely. Thank you so much for having me today. My role as a peer researcher is to receive constant training in this research. We will help co-design the discussion guide for our sessions. I will also be facilitating the listening sessions. And with this information that we gather, we will be informing Celebrate One with their strategic plan. So we'll be able to take this information that we gather and help Celebrate One so that we can figure out how we can change this rate. My team will be hosting 6 listening sessions, and that's to hear about women's experiences with maternal morbidity and maternal mortality. And that's such as women who have had personal experiences with injury due to pregnancy and childbirth, physical or mental illness due to pregnancy or childbirth, as well as pregnancy with high risk of injury or illness. Our target population is Black and Brown women. This is scientific research. So with scientific research, you have to go through the IRB when using human subjects. So right now we're waiting on our IRB approval, and hopefully we can start going ahead and recruiting starting in May. That is what we're doing.
Great, thank you. And also we will be posting on social media for folks to get connected with Michelet and her research team. And then if you're working with a community health worker, you can reach out to a community health worker and they can register you for the listening session. Again, that number is 614-570-3592. Michelet, I know families have a lot going on right now, and so if you could kind of give a plug, why do you think it's important that someone come to a listening session and share their story? If you could tell us why you think this is important.
I think that it's important for people to come and share their story with us here at our listening sessions, due to the fact that once we get this information and we actually go deep into the community and we start it's like a puzzle. You take one piece and then another piece and another piece. These are people's stories. And if we can come together as a conglomerate, we can take those stories, we can start to figure out what the issue is here. And once you figure out what the actual issue is, that's when you can start to conquer it.
I just want to give a big thank you to our guests and our viewers. This has been an incredible conversation. It's certainly not the end. I just want folks to know that you don't have to figure this out on your own. Call or text a community health worker today. If you don't have a community health worker, or if you're just now learning about Celebrate One, please reach out to us to get connected. We look forward to seeing you next month on May 28th for our next table talk. So thank you again and be well.